At the air ambulance base at Essendon Airport. But flight paramedic Matt's first case is confronting. He's on his way to a critically ill schoolboy in country Victoria.
5-6 for taxi. No right left.
You guys secure in the back?
Yeah, we're secure, doors locked, mate.
The boy's panicked friend has called for help after witnessing a terrifying sporting accident.
We're doing high jump. He missed the whole mat and I think he landed on his back and he's just shaking.
Okay.
He's not saying anything. He's struggled breathing as well.
Since crashing off the mat in the gym, the semi-conscious schoolboy has been having violent fits.
The current head injury patient will need to be sedated. He's highly agitated.
Disturbing reports from local paramedics at the scene are putting Matt on edge.
It sounds like he's had a loss of consciousness after he's hit the ground and he's very irritable and very unsettled.
Look at the trees now, just got the goalpost.
He's punching out, trying to hit people, trying to grab people, and so it takes 3 or 4 paramedics to actually hold him down and to be able to manage him.
Hey, how you going?
Very good, I'm cooking, mate.
That's right.
I've got
Logan.
For his own safety, Logan has been heavily sedated.
So he's come from a fair height with a fair bang. Whereas altered conscious state from the get-go. Really difficult to manage. Struggling to get baseline observations because he was just so agitated and kicking and flailing around.
Logan's dad, Chris, teaches at the school. For the last hour, he's watched on helplessly as his son has spiralled out of control.
Did you find any bumps, lumps or anything like
No,
that?
I didn't. Not, but to be honest, it was really hard to assess him because he was just so mobile.
When somebody bangs their head and starts to display seizure activity, it makes me think that they've got a significant brain injury.
No, it's just a normal average kid, plays sports and so forth. Yeah. What sports does he play? Footy, cricket? Footy and cricket.
Logan doesn't have a history of epilepsy, so I'm very concerned that that irritability that he's got going on beforehand was that he's actually had a bleed into his brain, which can cause him to deteriorate and obviously ultimately die.
What's his eyes doing? Is he about to have a seizure? It's okay, buddy.
Put that on a mute. Still trying to learn all these functions on this smartphone.
Phone's too smart for you.
You're right.
In Melbourne, Taz is venting to his partner Amanda. He just can't seem to work out his new phone.
I texted my friend, can I use your Wi-Fi? And it's auto-corrected to wife.
Can I use your wife? Can I use your wife? I mean Wi-Fi. That's totally what I meant.
I know. I said, look, I'm sorry.
How do you backpedal from that?
Yeah, I was so embarrassed.
With me too. Oh, that's so good. Oh, there it is.
But the laughs are over when an emergency call comes through.
RC139. It's just the case number 10627. Just looking at the history, we'll be upgrading on a 1 to this one.
Roger, code 1, that's fine.
So, Amanda, I think this female, she's 52.
Yep.
She's collapsed.
Yep.
She's vomiting.
Yep.
But at the same time, she's got a history of brain bleed.
Given the woman's history, Taz is worried she could be having a stroke.
Look at this traffic. The whole way down.
Oh, he's gonna break. Bleeding in the brain is one of the most serious emergency you can think of. Every minute counts. And I'll go up. This is easy.
Over this?
Yeah. It's easy. Easy. Oh. Sorry. First time you've done a four-wheel driving?
In an ambulance, it is.
Taz and Amanda have made it in good time, but they need to act quickly. Nearly half of all brain bleeds end in death.
G'day. She's your... what's her name? Donna.
Donna, a foster mum with 3 children,
Hello.
appears to be in serious trouble.
Oh, okay.
Hello, Donna. I'm Taz here.
Please, gonna blow up.
So it looks like he was about to have another seizure there. His pupils dilated and he's just become a bit stiff. So I'll give him some more medication now just to make sure he's nice and comfortable.
In country Victoria, Flight paramedic Matt is worried Logan could have suffered a serious head injury. The 14-year-old schoolboy crashed onto the floor during high jump practice and went into violent convulsions.
All right, Logan, just relax, mate. Just relax, mate.
Logan's mum, Fiona, has just arrived to find her son heavily sedated.
Okay, buddy. Okay, buddy.
His head, okay?
Just relax, buddy.
Dad Chris, a teacher at the school, has not left his son's side and is fearing the worst.
It was very distressing. He was having really aggressive fits and seizures and trying to roll over and sit up and stand up.
All good? Okay, buddy.
Yeah, he wasn't responding. Never seen him like that before.
Logan needs to be airlifted to hospital urgently, but to be moved safely, he has to be put into a medically induced coma.
Have we got the ketamine drawn up? Can I have the ketamine, please?
Come on, buddy.
Can we grab a blanket or maybe that pillow, please? I need to lift up his shoulders and support his head and just get this underneath him. Any intubation is an invasive, dangerous procedure. I'm going to stop him breathing and put him to sleep effectively and take control of his breathing. So is everybody pretty much ready? So I'll give him some medicine in a moment, which will make him really sleepy, and then I'll put that tube into his airway and we'll take over his breathing from that point. All right, so let's go with some drugs, please. Everybody ready? And you're on the suction. Yeah. You're ready to go. Cheers.
Which range? You've been looked after?
A failed intubation can starve the brain of oxygen and cause cardiac arrest.
You understand what's going to happen?
Yeah. I'm still scared about the unknown and what the outcome would be. It would be the worst day of my life, without a question.
That's a drug down the here.
Back to 99%, heart rate 120.
To take over Logan's breathing and put him into a medically induced coma, Matt needs to carefully place a tube down Logan's throat.
Can you just push on the gastric tube from this end? Just gentle push down.
Chest rise and equal.
There's a waveform, got misting of the tube, got good rise and fall, and we've got it entitled. That's great, I'll give you that.
The intubation has worked, but the long wait to see if Logan's brain will recover is just beginning.
Yep, that's great. Wonderful, that's terrific. So we'll just transfer him across onto our bed. We'll keep him nice and comfortable. He's going to sleep the whole way until we get him to hospital.
Dad Chris will travel with Logan in the helicopter, while Mum Fiona will go by road.
Ready, set, and go. So we're flying back into the Royal Children's Hospital, and I want to give the parents as much support and reassurance as possible, but I can't say exactly what's wrong with Logan at this point. I'm still concerned that he does have a brain injury.
Yeah, I was worried that is he actually going to regain consciousness? Is he going to make a full recovery? All the things you expect to do as a father and son, may not be able to be done in the future.
Look after yourself, buddy.
Yep.
Donna?
My head's gonna blow up.
In Melbourne's western suburbs, Amanda and Taz are also dealing with a confronting medical emergency. With Donna's history of brain bleeds, they're worried the foster mum could be having a potentially life-threatening stroke.
When did this start, Donna?
Half an hour ago.
Half an hour ago.
To walk in and find Donna in this much pain, I'm worried. Is she having a bleed and is it getting worse?
Have you taken anything for the pain, darling? Aspirin.
Out of all of the pain relief options she's got, she's chosen the worst one. Aspirin thins your blood, and if she's already bleeding, this is going to make this worse.
Either you can sit or you can lie,
down.
whatever is
Perfect.
comfortable.
Yeah, beautiful.
I'm
sorry. No, don't apologise.
No, can I look into your eyes then? Open your eyes.
Taz quickly checks Donna for the telltale signs of a stroke.
Can you squeeze my fingers, please? The other hand also.
In our stroke assessment, we need to ensure that the patient's got strong grip strength, whether or not they're suffering on one side more than the other, whether or not they're able to talk, whether there's any slurring or drooping of the face. At this point, other than Donna's pain, she's not showing any clear signs of having a stroke.
But that doesn't mean the foster mum is out of danger.
Oh, my head. I'm just about to give you some spray up the nose, okay? And that should help a little bit with the pain. Ready? Yeah. 1, 2, 3, 4. Okay?
Good. Donna, what other medical history you've got?
Migraine.
How often do you get migraine?
2 to 3 times a week now.
2 to 3 times a week.
It's knocking me around, so I'm shocking.
Does it feel like it's another one of the migraine?
It feels worse.
It feels worse.
A migraine's not just a bad headache. They are absolutely horrendous and they can affect you for days. I suffer from migraines and I know that pain. All I want to do is make this woman more comfortable.
You're all right. One big move to the stretcher and then that'll be it,
Got
okay?
medications ready.
That's it. Good girl.
In case.
At this point, we can't ascertain whether or not Donna's having a migraine or a bleed. Every second counts. This woman needs to get to hospital ASAP.
Good to go?
Yeah.
Okay, we're clear to come in there, guys.
Flight paramedic Matt is getting ready to emergency airlift Logan to the Royal Children's Hospital. The schoolboy has a suspected brain injury and has been put into an induced coma.
Happy to go whenever you're ready, mate.
Dad Chris has been watching the nightmare unfold.
Logan's dad seems quite controlled, but I know inside him he would be torn up and very distressed. It's a horrible experience for any parent to have to go through.
Everybody securing the back doors are locked, thanks. Roger, mate. Okay.
Yeah, Logan loves his footy, but he's a complete cricket nut. So to see him potentially not be able to play sport in the future would leave a big hole in his life.
Let's see what the scan says. Hopefully, just a knock on the head, he's got a bit of concussion, but got a cricket grand final on Sunday. Oh, has he? Which got delayed from last Sunday. Righto. Good afternoon, helicopter ambulance 1, inbound to the Royal Children's Hospital, medevac, requesting airway clearance.
At hospital, Logan will be kept in a coma until his condition stabilises. But there are no guarantees he'll ever play sport again.
So in terms of outcomes, you'd just be guessing at this stage? Well, seizure activity that he has concerns me that something's gone on inside his head, so we get the scan of his head when we get to the Royal Children's Hospital. But ultimately it's just now boils down to working out where we're at.
You have to use your words very carefully because you never know what the final outcome will be. I don't want to give Chris false hope that everything is going to be perfectly normal when they take Logan into a CT scan and it shows that he's got a significant head injury.
Logan will now be rushed to the emergency department where doctors will assess if the 14-year-old has suffered any permanent brain damage.
As I was walking across the helipad, all the potential bad outcomes, the worst case scenarios were buzzing through my head, whether he'd, be able to function as a normal person in the future. Am I going to have to feed my son with a spoon for the rest of his life?
Watch this truck not move. That's in the emergency lane.
Taz and Amanda are desperately trying to get Donna to hospital. They don't know if the foster mum's agonising pain is a severe migraine or a life-threatening bleed to the brain.
How long have you been suffering from migraine? Oh, so from very young age. Okay. Donna, may give you some oxygen, okay?
The pain relief's finally kicking in and Donna has calmed down.
You better now? Yeah, you look comfortable now. That's good. That's good. It's a big difference from the time we came into your room when you were upside down. At least you can relax now. Good. That's all right. We just want to make sure that you feel better and you get better soon. I hope Donna gets better as early as possible. Being a foster parent, I think there's a lot of people rely on her. It is a very demanding, it is a very challenging job.
Specialists at the Royal Melbourne Hospital are waiting to give Donna an MRI scan. If a bleed is found, her life is still in danger. As night falls across Melbourne, good mates Leonard and Nat are just starting work.
You know, it's nice. I feel like a teenager again. I do. I mean, because of my new guy.
Yeah.
Like honeymoon phase, you know, when you meet someone and you're all loved up and it's all exciting.
How much do I know about Natalie's love life? A fair bit now. I mean, there was a period where she was trying Jewish Tinder.
Oh, hello.
What are you doing?
I'm on J-Swipe.
Give me a look.
What do you think? Yes?
No,
gone.
I don't like it.
Right, gone.
I don't like to admit it, but I had a blast doing J-Swipe with her.
No, swipe left.
I don't think that was overly successful. But hey, she's found a pretty good guy, I think. Not on J-Swipe. I think she found him the normal way.
He may not be Jewish, but he slotted right in. You would mistake him for being Jewish. I mean, he's Jewish from the waist down, so does that count?
But it's back to business as the team is called Lights and Sirens Code 1 to a potential heart attack.
715 received, code 1. So, Leonard, the only information we have is that we're going to a 65-year-old male with chest pain. They're no longer on the phone with this patient. We don't know what the cause of the chest pain is. We don't know what his past history is.
We prepare for the worst, expect the best, is what we like to say. And I think anyone that calls an ambulance with chest pain, we need to take it very seriously.
Hi, I'm Natalie.
Hi, I'm Harriet.
Hi, Harriet.
Come on through.
Where am I off to?
Straight and left.
Hi. Hi. What's your name?
Warren.
Hi, Warren.
Warren and wife Harriet were enjoying their traditional Jewish Friday night Shabbat dinner when his left arm started aching.
He was going, oh my God, it's so sore, and I was feeling pain.
So it was quite severe when it happened?
No pain. I don't feel any pain at all, except for the discomfort of where it is. It aches.
Okay.
While Warren is playing his symptoms down, Nat's not buying it.
It feels muscular, like I've strained myself by lifting or pushing.
So when you move that arm around at the moment, does that change that feeling of discomfort at all?
Nothing really. It's just that a little bit heavy.
Just a bit heavy?
Yeah.
Although Warren's looking pretty relaxed, I think Harriet's telling me the real story. Heart attacks are very sneaky buggers. People assume that they will feel central crushing chest pain. People describe it as though an elephant sitting on their chest, but it's so often not the case. Warren may be having a heart attack tonight.
Emergency services.
There's been a hit and run. It was two cars. There's like one car sideswiped another.
Okay.
At Melbourne's Emergency Communication Centre, an eyewitness to a shocking car crash is on the line.
It was pretty bad. He went across 3 lanes and just went over the curb and into the back of trees and houses.
Do you know if there's anyone injured?
I hadn't stopped. I'm about probably a K from him.
The car that went into the trees, how many people were in it?
I don't know. It was a small car. I've seen him in the rear mirror. He's gone flying.
Intensive care specialist Cullen's on his way to the accident on the busy Nepean Highway. He's taking the shortest route possible.
One of the great things about Melbourne is that we have tram tracks, which allows emergency services to get through a lot of heavy traffic.
As he arrives, all Cullen knows is the hit-and-run victim has slammed into a tree.
I'm yet to see how significant that impact was.
but the car always comes out second best when it hits a tree.
Group 1 patient who's currently trapped by his leg.
99 receiving. When I first see the car, my worst fears are realised. The driver's door is wrapped around the tree. How can anyone survive this? This is a massive impact.
All right, mate. We're going to a 55-year-old female who's fallen from her bicycle and injured her wrist.
Mike and Eamon have been called to a cyclist in trouble in a popular Bayside suburb.
Most important thing you're going to be asked all day, what's this lady's name?
What is this lady's name? A 55-year-old female cyclist. Her name is going to be Helen.
Guessing patients' names is an Eamon game. I've never done it before, but I love it. It's always a bit of fun, and it just helps with that relationship between us. Really makes us work well. I'm going to go with Sarah.
There's a lot of Sarahs out there.
There is. I'm just playing a numbers game now, mate.
We've got to get one day.
We've got someone pointing. Oh, yeah, here we go.
So first thing we always ask, what's your name? And if I get it wrong, it's a little bit of heartbreak. Hello, what was your name?
Not a Sarah and not a Helen, as Eamon guessed. With the name game, we never get it right. That's part of the fun.
Diane, don't you worry. My name's Eamon. I've got Mike with me.
Diane and her friend Jamie were on their way to buy cat food when her bike got stuck in a tram track and she crashed to the ground.
I skidded.
All right, deep breath, deep breath.
I don't usually like to fast.
Okay, don't stress.
The tram track just caught me.
We so often go to patients who get their wheels stuck in the tram tracks, and as soon as that wheel goes in there, it's game over for them. So tell me, where are you sore?
My hands get really angry.
Your hand's giving you grief. Okay, can you wiggle those fingers for me?
I don't really want to.
You don't want to do that. That's fine. No, I'm not going to make you do that, okay? It's all right. You take a deep breath. Diane.
During the fall, Diane's head was protected by a helmet, but she could have injured her back or spine.
You're not sore anywhere else, not in your legs or anything. You're able to walk after that. You didn't knock yourself out in the process. Okay.
I'm sorry.
That's okay. All right.
Assessing the highly emotional patient is turning out to be tricky. Eamon needs to calm her down.
It's a really easy trap to fall into, to go, oh, she's just a bit anxious or she's just a bit upset, and therefore miss a really serious injury. But it's impossible to assess someone who's really distressed. So that's why the first thing that we always want to do is rest and reassure that person.
Take a deep breath, all right? We're going to take very good care of you, all right? I promise.
Warren, what we'll do is we'll check you out, head to toe. We'll get all your vital signs.
In a nearby suburb, Nat and Leonard are worried 65-year-old Warren is still having a heart attack.
What have you had in the
I've had a
past?
stent.
Yes.
Before.
So have you ever had chest pain before?
I've had...
Or a heart attack?
I haven't had a heart attack.
Okay.
Warren is not worried about his symptoms, but wife Harriet is sure something sinister is going on.
Concern is because he's diabetic, he's been told that diabetics don't feel the pain.
They can have silent heart attacks.
Correct.
Being a diabetic changes everything. Diabetics can have what we call silent heart attacks. So they have a heart attack with some of the symptoms, but not necessarily pain.
Right.
65, did you say?
Yeah.
Leonard's now tracing Warren's heart rhythm for signs of trouble.
Okay.
Nice and still
so
for a
arms
second.
down, normal breathing for us.
All right.
You check your sugar all the time, do you?
Yeah, let this be very hard.
Has it?
Because he has diabetes, Warren is twice as likely to suffer cardiac problems and is a prime candidate for a deadly heart attack.
So it looks fine. The sinus rhythm
Is that what it's saying?
looks fine.
Okay.
I perform a 12-lead ECG and it comes back as normal, but it doesn't mean he's in the clear.
So the good news is we can't find anything wrong. The bad news is I do think any sort of left shoulder, arm, chest pain without explanation should be investigated at hospital.
Yeah.
Okay, let's go. Lovely to meet you.
You too, good Shabbos.
You too, good Shabbos.
You want some malaga while you're here?
I'd love
Piece
some.
of challah?
I love some colour.
Of course, Harriet is trying to feed me. I mean, it is Friday night Shabbat dinner. That is what we do. We eat. She's offering me callouts. It is this sweet, soft egg loaf. You can't get anything better.
I'll get you to step on in.
But considering all the risk factors Warren has, I want to get him into the ambulance and off to hospital.
Did you get some of that colour?
No, I didn't. Hurry up, Brenda, bring this in.
She's not coming.
I know. Just call it. Bring the colour.
It's great that Warren's pain-free at the moment and everything's stable, but there's nothing to say that chest pain won't come back or that he may deteriorate in front of me. He's not out of the woods yet.
We're good to go.
Back on the busy Nepean highway, intensive care paramedic Cullen has arrived at the scene of an horrific hit and run. As he approaches the trapped driver, he has no idea just how severe the injuries will be.
Okay, mate, how you going? My name's Cullen. I'm from the ambulance. Have you got much pain in your legs?
Yeah.
Pain in your hips? Can you move your feet?
I can't move it like that, yeah.
Yeah.
He's fully, the door's fully on his...
Yeah, sure.
28-year-old Abdul has been sideswiped off the road.
Do you have pain in your leg here or leg down there?
Yeah.
You do? All right.
He's still trapped from his waist down by the car. I'm trying to see what his injuries are at the moment, and we won't be able to fully assess those until we get him out of the car.
How old are you, mate?
I'm fine.
Sorry?
I'm fine.
How old are you?
I'm fine.
As I'm looking in the car, it's dark, but I can see that Abdul is a bit confused, which makes me suspicious that he has sustained a head injury.
So what we're going to do, we're going to put a needle in your arm. We're going to give you a little bit of pain relief to get you out of the car. We're going to rely on heavy rescue to actually chop out some of this car before we can extricate you, all right?
Just about through on this side.
Have you got access to his legs over there yet? Yeah. Yeah, would it interfere with you guys if I came around and actually inspected his legs and pelvis? Have you got pain on your hips in here? If I push in there? No, what about your tummy? Any pain in your tummy? No? All right.
If Abdul has internal injuries, he could be bleeding out.
From looking at the cabin intrusion and the impact that the tree has had on Abdul's car, there's a really good chance that he's got a fractured pelvis or broken pelvis and broken upper legs. Both these injuries can be potentially life-threatening.
Diane, what are you so upset about, Diane?
It's getting late, and Eamon is still trying to pacify the traumatised Diane. She was heading to the shops for cat food when her bike got jammed in tram tracks and she crashed to the ground.
It's hurting. All right, that's what we're going to get sorted right now, all right? Okay.
Reassuring patients, it's the cornerstone of what we do. Once we've calmed a patient down, that's when we start to get a real understanding of what's actually wrong.
So this medication's called fentanyl. It's a couple of... How old are you, I'm sorry?
I'm 50. Sorry?
No worries. I'm going to give you a couple of squirts up each nostril.
21.
21. That's what I was thinking. And then once we get in the ambulance, we'll look at maybe putting a needle in your arm to give you something a bit further for the pain, OK?
With Eamon's charms and the pain relief working their magic,
1, 2.
treatment of Diane's injuries can finally start.
Pardon me, I'm going to sneak in there beside you.
This is Diane, I don't know.
Oh, hey, Diane. Sorry, I'm Mike.
You look like you've done a couple of rounds with Mike Tyson.
Really? Yeah. You've still got your ear, though. Was he the ear biter?
I think so, yeah.
Yeah, right. So this won't be tight.
Diane's badly injured wrist may not be her only problem. Eamon still needs to rule out a spinal injury.
You're not sore anywhere else, not in your legs or anything. You're able to walk after that. You didn't knock yourself out in the process.
No, I didn't want to injure this.
Oh,
so
no, that's understandable. Yeah.
Fortunately for Diane, she doesn't seem to have any tenderness. She hasn't got any sort of altered sensation in her fingers, so I don't have any major concerns for Diane's spine at this stage.
Where do I sit on this thingy?
Yeah, you sit on the bed for me, all right? How's your pain at the moment?
Oh, yeah, when I do that, when I move that, it's really bad.
Where's that, Zora? And you're at wrist there. Yeah.
Diane will be fully checked out at hospital, but tonight's trauma is taking its toll.
Diane.
I'm playing the guitar, what am I going to do?
Diane. Diane.
I'm pretty good with playing music, but this is really bad.
Poor Diane, she's a bit of an emotional roller coaster.
Here you go, tissues.
Just when Mike and I think we've got her reassured and calm, and then she gets upset all over again. So we have to just let her know that everything's going to be okay and wait for some of that pain relief to kick in as well. She's going to live, but it's going to suck for the next little while.
Diane, look at me, look at me, look at me.
You shouldn't have this much. Sorry.
Nat and Leonard are on their way to hospital with a much calmer patient. They're worried diabetic sufferer Warren could be having a heart attack.
You sending emails?
No, not at all.
No?
I'll find you something.
Okay.
There you go. That's the Baker IDI.
Yep.
But the 65-year-old's so stoic, he's more interested in showing off his profile on a Diabetes Institute website.
Looks can be deceiving. Warren lives with type 2 diabetes, heart disease, yet despite his countless doctor and specialist appointments, he is a ticking time bomb. That doesn't sound very promising. You're a ticking time bomb.
Warren's pretty proud of the fact that he's the poster boy for the Diabetes Institute. I don't know if it's such a good thing.
This bomb is not going off tonight, that's for sure.
It's great that Warren's stable at the moment. He's pain-free, he's smiling, he's laughing, but at the back of my mind, I know that I need to make sure I continue to assess him in case anything changes.
I know I'm not the fittest guy on the planet, but years ago I used to be a weightlifter.
Did you?
You know what a clean and jerk is?
Clean and jerk. Clean and jerk. I assume he's talking about weightlifting. Yeah? Yeah. Let's go with it.
Lift to here,
Yes?
then up,
Okay, so lift to there.
and then up.
That's called a clean and jerk. Clean and jerk. Have you heard of that, Leonard?
I have.
Oh, you have? Okay.
But despite the banter, Nat remains concerned that her ticking time bomb patient could still go off.
As much fun as I've had chatting to Warren, at the end of the day, he's had an episode of severe chest pain. I'm really glad to get him to hospital where he can be provided with definitive care. He needs an ECG done, he needs blood tests, potentially an X-ray. He could be really sick.
Okay, we'll take you on in, Warren. You comfortable?
Yeah, I'm fine.
Warren thinks he's fine, but cardiologists will decide whether the former weightlifter needs immediate life-saving surgery.
How's the pain, mate?
Just a few kilometres away at the scene of a terrifying car crash, Cullen's trying to find out if the victim's legs have been crushed.
Can you feel me touching you there? That feels normal. What about there?
28-year-old Abdul left his family behind in Pakistan to study in Melbourne. Tonight, he's lucky to be alive.
We don't know the full extent of his injuries yet, and we won't be able to fully assess those until we get him to hospital safely. But I can see some blood coming out of his ears, which isn't a good sign.
All right, let us know if there's any pain anywhere at any time.
Abdul's flatmate Fez started worrying when his best friend didn't come home.
It was a terrible night. He wasn't answering my calls at all, not replying to my messages. I was really, really worried. He's like my brother.
We're going to bring a board in from this, put it underneath your bottom. We don't want you to help us. Then we're going to pull you out and manually stabilise your head while we get you onto the board, okay?
Cullen's worried Abdul could have suffered a fractured pelvis or potential spinal injuries.
When you have internal bleeding, every second counts. If we're delayed in any way, it could have significant consequences. We need to get him safely out of that car and get moving.
Yeah, put the board under his legs there. Mark, are you able to, hang on, don't help us, don't help us, don't help us, don't help us. Stay there, mate. Can you straighten your legs? All right, shuffle up. Have you guys got the board up that end? Lie down, all right. Can you put the pelvic binder on?
Whilst we're extricating Abdul from the car, we need to be really careful that we don't injure him further. So we need to treat him as if he does have a spinal injury until he gets x-rayed at hospital.
On go, we're gonna just lift and stand up. Is everyone ready? Yep. Ready, set, go. All right, so we'll walk either side of the bed. It's nice and still. Don't move unless we ask you to, okay? Yeah, all right, we're going to get you in the ambulance now.
Abdul's being rushed to the Alfred Hospital Trauma Centre while rescue teams work to clear and reopen the highway.
Abdul, can you wiggle your toes for me? Can you wiggle your toes? Once I get Abdul into the ambulance, to my amazement, he's sustained no significant lower limb injuries that I can see at this point in time. Push back up. But it's the injuries that I can't see that I'm worried about. All right, we're just arriving at the Alfred now. Abdul, all right?
At the emergency department, if scans confirm internal bleeding, Abdul will be taken straight into emergency surgery.
I can't help but think that Abdul's been hit by another car that didn't stop to render any assistance. He's done nothing wrong, and one simple act can potentially change his life forever. Trauma 2.
You shouldn't hurt this much, you shouldn't.
In Melbourne's Bayside, Eamon and Mike are trying to calm down Diane. She was on her way to the shops with her friend Jamie to get cat food when she came off her push bike and badly injured her wrist.
I'll pop a little needle on your arm and
Did you get the cat food?
That's all right, he's getting everything.
Did you get the cat food?
Diane, you stop worrying about everything else, okay? I can see you stressing about everything else. You're the main focus now. The cat food will get sorted. I know you're upset. I know it's stressful when this happens, but you're okay, all right? You're in very safe hands with us.
So pretty.
I'm going to pop a little needle in your arm and get that pain under control.
Did she just call him pretty? I definitely would not refer to Eamon as pretty. Pretty average looking, maybe. Let us get you to the right place and everything will be okay, all right? You've got a very good paramedic here looking after you. I'm not talking about myself, I'm talking about this guy.
The boys now need to keep Diane distracted so they can give her a needle for her pain.
So what sort of cat have you got, Diane?
He's an Egyptian water cat.
An Egyptian water cat?
He was a rescue cat. He was 3 weeks old.
Sharp little scratch.
You're an adoptive cat mum then. What's his name?
Munch.
Munch, that's
Because he eats like a pig.
I'm a big fan of Munch. Munch is the best form of pain relief I've got right now. Thank you, Munch.
With Diane pain-free at last, they can make their way to the nearest emergency department with a much more relaxed and very grateful patient.
I always feel my #1 heroes because you always help everybody. You're life and death, or life and care.
Word is officially in from Diane. We're #1 on her hero list. Diane is well on her way to being my all-time favourite patient ever.
Oh, we're here.
We're here. He's an efficient driver, Mike.
It's good. Thanks, Mike.
Oh, you're very welcome. The trick is not to stop for red lights.
Diane's had some pain relief, she's had a bit of a flirt, she's talked about her cat. Now it's time for her to get some x-rays and get this arm sorted.
The triage nurse is a good friend of mine, so make sure you give her a hard time.
Get.
It's now 12 weeks since overseas student Abdul crashed into a tree, but he's back on his feet, playing his favourite sport with best friend Fez.
इतना तो तू भागते है.
Hang on, don't help us, don't help us, don't help us, don't help us. Stay there, mate.
On the night of the accident, Cullen was worried Abdul had crushed his legs and could have devastating internal bleeding.
I was in hospital for 6 days, and it took me 2 to 3 months to recover fully. If you go to Windows.
Abdul did suffer a fractured pelvis and jaw, a broken collarbone, and a brain hemorrhage, but has fully recovered and is back at uni finishing his IT course.
The other driver, he called me after the accident, and now he is a good friend of mine. I'm so grateful to have another chance again. One more chance to live this life. Yeah, I feel so lucky.
Please, get up, Lemo.
Foster mum Donna is also recovering from her ordeal. After a couple of nights in hospital, a stroke was ruled out, and she's now being treated for chronic migraines.
Can you wiggle those fingers for me?
I don't really want to.
You don't want to do that. That's fine. No, I'm not going to make you do that, okay? Diane.
It's been 2 months since Diane fell off her bike after she got stuck in tram tracks while out buying cat food.
So what sort of cat have you got, Diane?
He's an Egyptian water cat.
An Egyptian water cat.
Eamon's charms kept her calm, but Diane's wrist was broken. After surgery, doctors sent her home to recover with rescue cat Munch.
Wow, Munchy, Munchy. But I can still ride. I'm very cautious because I need this hand. I write, I draw, I do all those things. So I'm listening to everything they told me and doing the right thing. I mean, your body's a temple. It's a temple. You've got to take care of the temple. In my mouth.
I don't feel any pain at all.
Nat and Leonard were worried that diabetic poster boy Warren was having a heart attack.
He's been told that diabetics don't feel the pain.
They can have silent heart attacks.
Correct.
And they were absolutely right. Shortly after being taken to hospital, Warren had a cardiac arrest and nearly died. He had 3 stents fitted and will never be blasé about the warning signs ever again. And it's now 3 months since Logan was airlifted to hospital with a suspected brain injury after he crashed to the floor during high jump practice.
They took him for scans quite quickly, and within possibly about 40 minutes to an hour, I got the news that there was no damage to his skull, no damage to his spine, and no damage to his brain. It took me a little while to actually process the news that it was good news, but it was amazing.
You get tired?
Nah, not yet, mate. Not yet.
Logan's only just started playing sport again and did miss the big event he'd been looking forward to.
I missed a cricket grand final, which was 3 days after I hurt myself, and we lost by 30 runs. That was really disappointing.
Life can be fragile, but at the same time, don't wrap yourself in cotton wool. Make sure each day counts and take on all the adventures and the things that life has in front of you. So yeah, it's a great reminder how precious life is.